Hello, I'm Sarah Macdonald, and today I'm talking to Professor Robyn Richmond, who's a Professor of Public Health, and we're going to talk about smoking. Professor, we've had some big wins on smoking lately, but we still have 15% of Australians who smoke. Who's still smoking?
Yes, well, we should pat ourselves on the back for the 15% because that's one of the lowest in the world. But there are still groups within our country that have very high smoking rates. Certain Indigenous groups where the rates are very high. Even among pregnant women, certain groups that come from other countries, the rates are very high, particularly amongst the males. And among prisoners, rates are extremely high. Those who have a mental illness also are most inclined to smoke, and those who use other drugs often use smoking in addition to their other drugs.
And it also seems it's concentrated in areas of lower socioeconomic wealth.
Yes, those who come from lower socioeconomic groups are most inclined to smoke compared to those who don't. More than double, I think.
So in terms of that, we now have the cost of smoking concentrated in these areas, and this is where the focus of public health is going. But they've also found that these groups find smoking the hardest to give up. Why is that?
Smoking's different to other drugs. Most people who use other drugs are not necessarily addicted, whereas people who smoke are addicted. They're addicted to administering their dose of nicotine probably every hour, every 20 minutes, because if they don't, they suffer withdrawal symptoms.
Tell us about the program that has been done in Lithgow Jail, where you got prisoners to try and give up smoking. And I would imagine in a jail, it's one of the few pleasures they've really got left. So it must be a pretty hard task.
Well, that's what we thought. And then when we started doing our study among prisoners, by the way, not just in Lithgow, but we have run the study in all 30 jails in New South Wales. And yes, we were very surprised to learn that the prisoners are very keen on physical activity. In fact, most of them are very engaged in doing some sort of physical activity. So we built upon wanting to be physically fit by adding wanting to stop smoking as well.
So you found prisoners were keen to give up smoking, a lot of them?
Yes, they were disappointed when they didn't get into the study because we had certain exclusion criteria, and if they didn't meet those, then it didn't meet the inclusion criteria, then they of course couldn't join the study, and they were very disappointed. But yes, we had no trouble recruiting prisoners to our study.
And what did you find was effective for helping prisoners give up smoking, given that a lot of them had smoked for many, many years?
Yes, and they certainly had, and many of them were using drugs both in prison and before they came to prison. Many of them came into prison because they had some alcohol-related violence of some description. We had a multi-component intervention, which include motivational components, which were all evidence-based, and we also used combination pharmacotherapy that was known to help people to stop smoking.
What do you mean by that? What's pharmacotherapy?
Well, we used the nicotine patch, which most people have heard about, and that's been shown to help people to give up smoking. And we also used another anti-smoking medication called nortriptyline, which is, as I said, an antidepressant, but it's used in subclinical doses for depression. So it's a very small dose of nortriptyline. And we used that in combination with a range of resources. And what we did was we worked with the prisoners to develop a range of resources, such as the Break Free booklet, which was developed by prisoners for prisoners, a calendar which the prisoners came up with themselves, and they developed. It's a step-by-step approach. We also had the stressor package because it's very stressful for prisoners because many of them are bullied, many of them are transferred without any notice at all to another prison, or they have court appearances. So they wanted that stressor package.
And did you find the antidepressant, the low dose, helped in giving up smoking?
We found that used in combination with the nicotine patch, if they actually used it for the time that they were meant to, they were more likely to be successful than if they just used a small amount of it and then gave it up.
And in terms of that, you mentioned other drugs. Was that another factor? Because smoking often goes with drinking and it often goes with other drugs. Is it easier to give up if you don't have other drugs, especially with prisoners?
one of the predictors of likely success was if they weren't using heroin. So if they were using heroin either before they came into prison or whilst they were in prison, they were less likely to succeed.
So it's a complicating factor. You've got
Very.
to try and give up the heroin as well.
Yes.
What about in New Zealand? They banned smoking in prisons. Should we do the same here?
We actually have in several prisons. Some of our prisons are private prisons, and so they are smoke-free. And many prisons actually have smoke-free wings, so you can actually choose to be incarcerated in a wing and share a cell with somebody that doesn't smoke. So you do have that choice.
But I must imagine if you're going into a prison that's smoke-free and you smoked for years and years on the outside, do they help them, or is it just cold turkey? You go in, you adjust to prison life and give up ciggies on the same day?
I think it's the latter. I don't think they're helping them adjust to a smoke-free lifestyle, no.
So what's your response to that? It must be pretty difficult for them.
Well, I think it's extremely difficult, and I, for one, would be helping them with either some nicotine replacement therapy or some motivational programs. We also created access to the Quit line, which could be helpful as well.
You mentioned mental illness, and I know there's been research done on people with mental illness and smoking. What did you find works with this population?
Yes, we've done a series of 4 studies, and we're continuing to do that. And what we found, this is more comprehensive than the prison study. In the prison study, we ran motivational counselling over 2 visits. Here, for those who have a mental illness, this was severe mental illness we're talking about, schizophrenia and psychotic episodes. We had a series of about 8 visits, which sounds like quite a lot, but in fact it is very difficult for people who have a mental illness to try and give up smoking. So we had a number of visits, and we also had use of nicotine replacement therapy as well.
And what was the most successful? You didn't try the antidepressants with this population?
No, we didn't, because they were already on antidepressants. So we have to be very careful that we don't give an overdose of antidepressant. And what we found was that it was very successful for those who actually attended most, not all, but most of the visits. So those who just came along once or twice, they were less likely to be successful than those who came for most of the visits.
And what about the general population, those that are still smoking? What is the best way to give up smoking?
Well, some people would say just give it up cold turkey, and that is by far the most common and popular way. But I think we need to look at many people who give up on their own without any assistance, in fact go back to smoking up to a year after not smoking at all. So I would advocate going to their general practitioner and getting advice from him or her. They have a range of different resources as well as skills, because we've been training doctors now for many years. There are guidelines for smoking cessation for Australian general practice, and my colleagues and myself have developed a series of guidelines, and this helps the doctor to give evidence-based strategies to help smokers to quit. And we have algorithms so that if the person is a very heavy smoker and it has this sort of circumstance, maybe pregnant or not pregnant, or have a mental illness or depression, etc., we have algorithms for the doctor to use.
So the algorithms will set the treatment plan?
Yes, exactly. That's exactly what it does.
What about the new legislation that's the win the government's had in the High Court about plain packaging?
I think it's absolutely excellent, and certainly Australia leads the way on that.
How low do you think we'll get below 15% of the population smoking with these sort of initiatives?
I think the plain packaging will raise awareness of the issue. There are a number of different initiatives in the community, including training doctors and other health professionals, and smoking cessation, actually helping people to quit, that will work in concert with the raising awareness issues.
If it's only 15% of Australians still smoking though, is it worth the time and the effort? I mean, what are the costs?
The costs up front are so cheap compared to the costs of hospitalisation from cigarette-related diseases. Most of the major diseases, their major risk factor is smoking. Heart disease, atherosclerosis, cancer, diabetes. So if we can get people to stop smoking, we can reduce the rate that people will be getting these diseases. And of course that has major cost implications to the community. So it's very much a cost reducing exercise. Cost in terms of financial terms, cost in terms of losing loved ones from cigarette related diseases.
Thanks so much for your time today. Good to talk to you.
Thank you.